One of the main concerns in our patients and globally speaking is the risk of getting the medication, getting the gonadotropins, going through the ovarian stimulation phase, and if these hormones may induce cancer or may complicate the life of the patient, inducing diseases that she doesn't have. And I think today we can be completely reassured that this medication, these protocols, the gonadotropins that we use, will not compromise the health of our patients. And I think we have very good examples. Two of them are really good and give this reassurance that we need to transmit to our patients so they don't get scared or worried about the medication. First of all, there's a very large study done in the Netherlands, and they followed for 21 years 25,000 women, and they looked at the incidence of breast cancer in this large group of women, and they compared the incidence of breast cancer with a similarly large group of women who didn't undergo IVF, followed for again 21 years. And when you look at these two groups, of course there was cancer in women that went through IVF, but the incidence was exactly the same as in those women who didn't have IVF, which is more or less 1 in 9. The problem is that breast cancer is so everywhere that you will find women who did IVF and later may have a breast cancer, but the incidence and the risk is exactly the same as if they never had been exposed to this medication. So I think that's one of these great papers that we need to use and explain to our patients to be reassured. Second, we recently published a paper on women who came to us with breast cancer to freeze their oocytes. They wanted to preserve fertility, and they had been diagnosed previously with breast cancer, and they were going to be exposed to gonadotropins. So what we did is a group of 250 women, half of them decided to freeze the eggs, so they were exposed to ovarian stimulation, gonadotropins, and hormones. The other half opted not to freeze their oocytes, so they were not exposed to this medication. And then we looked at the survival rate 5 years later. What was the progression of the disease and the survival rate 5 years after the treatment? And it was exactly the same. Fortunately, we have also this data today that even if you are already diagnosed with breast cancer disease, being exposed for 9 or 10 or 11 days to gonadotropins is not going to compromise your health. So now we have both parts of the equation. We can be completely sure that neither the medication is going to expose you to high risk of breast cancer, and even if you have the disease already, freezing your eggs for fertility preservation is not going to compromise your outcome or your survival 5 years later. So I think these both are very good news in terms of safety for our patients.